you hit on the third leading cause of death in the United States, and I'm sure most of us could figure it's either heart-related or cancer or diabetes, things like that. Can you clue us into what that is and why?
Yeah, okay, and thank you for asking that, because this is the 10,000-pound gorilla in the room that nobody's talking about. The third leading cause of death, as published in the Journal of the American Medical Association, is MD-directed treatments. This means you go to a medical doctor, an MD, he gives you a treatment and you die from it. According to the United States Department of Health and Human Services, 15,000 Medicare patients a month are killed by MD treatment, and nobody goes to jail. A handful of terrorists fly 2 planes into the Twin Towers. 3,500 people die and we go to war. But 15,000 people a month are killed by medical doctor treatments, and we don't bat an eyelash. This is because we have been, I don't want to say brainwashed, that's not the correct term, but we have been, for the last 100 years, kind of led into this false belief. You know, I think it was Marcus Welby that started it, that the medical doctor is king and knows everything about everything. And really, you need to just shut up and follow your medical doctor's advice. Most people in the United States have no idea at all of the history of the evolution of medicine in the United States. In the early 1900s, it was a relatively level playing field between the chiropractors, the osteopaths, the homeopaths, and the MDs. In 1915, 1920, there was something called the Flexner Report. The Carnegie Corporation funded this man named Abraham Flexner. He went all around the country, and he went on stagecoach and train and horseback. This was before the interstate highway system, right? Took Flexner 5 years to do this. He went all around the country and did an inventory of all of the medical schools that prescribed drugs. He brought the list back to the Carnegies, who own drug companies, and then the Carnegies and the Rockefellers gave millions of dollars of free money to the medical schools and hospitals in the United States that were prescribing drugs. That was the beginning of the end. After the Flexner Report, there was no more level playing field in the United States. And the MDs started a juggernaut that's taken off. Most people in the United States think that the predominant medicine here, MD-directed pharmaceutical medicine, we think that those guys are top dog because their therapeutics are better than the homeopaths or the naturopaths.